What is a cataract? A cataract develops when the lens in your eye, which is normally clear, becomes foggy. For your eye to see, light passes through a clear lens. The lens is behind your iris, colored part of your eye. The lens focuses the light so that your brain and eye can work together to process information into a picture. When a cataract clouds over the lens, your eye can't focus light in the same way. This leads to blurry vision or other vision loss, trouble seeing. Your vision change depends on the cataract's location and size. A cataract is when your eye's natural lens becomes cloudy. Proteins in your lens break down and cause things to look blurry, hazy or less colorful. Inside our eyes, we have a natural lens. The lens bends, refracts, light rays that come into the eye to help us see. Vision problems with cataracts. If you have a cataract, your lens has become cloudy, like the bottom lens in the illustration. It is like looking through a foggy or dusty car windshield. Things look blurry, hazy or less colorful with a cataract. Cataracts are very common as you get older. In fact, more than half of all Americans age 80 or older either have cataracts or have had surgery to get rid of cataracts. At first, you may not notice that you have a cataract. But over time, cataracts can make your vision blurry, hazy, or less colorful. You may have trouble reading or doing other everyday activities. The good news is that surgery can get rid of cataracts. Cataract surgery is safe and corrects vision problems caused by cataracts. How a cataract forms. A cataract is a cloudy lens. The lens is positioned behind the colored part of your eye, iris. The lens focuses light that passes into your eye, producing clear, sharp images on the retina, the light-sensitive membrane in the eye that functions like the film in a camera. As you age, the lenses in your eyes become less flexible, less transparent and thicker. Age-related and other medical conditions cause proteins and fibers within the lenses to break down and clump together, clouding the lenses. As the cataract continues to develop, the clouding becomes denser. A cataract scatters and blocks the light as it passes through the lens, preventing a sharply defined image from reaching your retina. As a result, your vision becomes blurred. Cataracts generally develop in both eyes, but not always at the same rate. The cataract in one eye may be more advanced than the other, causing a difference in vision between eyes. Who gets cataracts? Most people start getting cataracts around age 40. But you probably won't notice symptoms until after age 60. Rarely, babies are born with cataracts due to a birth defect. You're more likely to develop cataracts if you 1. Smoke cigarettes. 2. Live in an area with bad air pollution. 3. Use alcohol heavily. 4. Have a family history of cataracts. How common are cataracts? Cataracts are common among older people. More than 50% of people age 80 and older have had cataracts. What are the symptoms? Cataracts usually form slowly. You may not know you have them until they start to block light. Then, you might notice 1. Vision that's cloudy, blurry, foggy, or filmy. 2. Nearsightedness, in older people. 3. Changes in the way you see color. 4. Problems driving at night, glare from oncoming headlights, for example. 5. Problems with glare during the day. 6. Double vision in the affected eye. 6. Trouble with eyeglasses or contact lenses not working well. Cataract causes and types. Cataracts form when protein builds up in the lens of your eye and makes it cloudy. This keeps light from passing through clearly. It can cause you to lose some of your eyesight. There are many types of cataracts. Nuclear cataracts. Also called a nuclear sclerotic cataract, this is the kind doctors see most. Anyone who lives long enough usually ends up with one. They form in the center of the lens, known as the nucleus. As they get worse, your reading vision may actually get better. It's called second sight, but it doesn't last long. Over time, the lens hardens and turns yellow or even brown. You have a hard time seeing small details, colors get less rich, and you see halos around bright objects at night. Cortical cataracts. These take shape on the outside edge of your lens, called the cortex. They start as white wedges, like triangles that point toward the center of your eye. As they grow, they scatter light. The main symptom is glare. You may find it hard to drive at night. They can also make your vision hazy, like you're looking through a fog. It may be hard to tell similar colors apart or to judge how far away an object is. Since they can spell trouble for both near and distance vision, you typically get them removed early on. Posterior subcapsular cataracts. These form just inside the back of your lens capsule, the part of your eye that surrounds the lens and holds it in place. They're directly in the path of light as it passes through the lens. They're quicker to come on than other cataracts, and you may get symptoms within months. They affect your close-up vision and make it harder to see in bright light. Anterior subcapsular cataracts. This type forms just inside the front of your lens capsule. An injury or swelling in your eye can lead to one. So can a type of eczema called atopic dermatitis. Congenital cataracts. These are cataracts that you're born with or that form when you're a child. Some are linked to your genes, and others are due to an illness, like rubella, that your mother had during pregnancy. When they're smaller outside the center of the lens, they may not need treatment. But when a baby's born with one that blocks vision, a doctor needs to remove it because it can stop the eye from learning to see. Traumatic cataracts. Many kinds of injuries can lead to a cataract. You can get one if you're hit in the eye by a ball or get hurt from a burn, chemical, or splinter. The cataract could come on soon after the injury or not show up until years later. Secondary cataracts. When another condition or a medical treatment leads to a cataract, doctors call it secondary. Diabetes, taking steroids like prednisone, and even cataract surgery are possible causes. Radiation cataracts. You may know that it's important to protect your skin from the sun's ultraviolet, UV, radiation, but it can take a toll on your eyes, too. You can sometimes get cataracts if you spend too much time in the sun without eye protection. People who work outdoors, like fishers and farmers, are more likely to get this kind of cataract. To prevent it, wear sunglasses with 100% UVA and UVB protection. Cataracts are also a possible side effect from radiation therapy for cancer. Lamellar or zonular cataracts. This type typically shows up in younger children and in both eyes. The genes that cause them are passed from parent to child. These cataracts form fine white dots in the middle of the lens and may take on a Y shape. Over time, the whole center of the lens may turn white. Posterior polar cataracts. You get these on the back center of your lens, and they're often due to genes that are passed down through your family. Posterior polar cataracts often don't cause symptoms, which is good because they're hard to remove. Anterior polar cataracts. They form on the front and center of your lens and look like small white dots. These cataracts typically don't bother your vision. Post-vitrectomy cataracts. Vitrectomy is surgery to remove your vitreous, the clear gel at the center of your eye. The operation can help with certain eye problems but may lead to a cataract. Christmas tree cataracts. Also called polychromatic cataracts, they form shiny, colored crystals in your lens. They're most common in people who have a condition called myotonic dystrophy. Brunescent cataracts. If you don't treat a nuclear cataract, it turns very hard and brown. This is called brunescent. It makes it hard for you to tell colors apart, especially blues and purples. Surgery to remove it is harder, longer, and riskier than when you get treatment earlier on. Diabetic snowflake cataracts. This is a rare type of cataract that can happen if you have diabetes. It gets worse quickly and forms a gray-white pattern that looks like a snowflake. What causes a cataract? The lens of your eye is mostly water and proteins. As proteins break down over time, they hang around in your eye. These lingering proteins can make your lens cloudy, so it's hard to see clearly. This is a typical, though unpleasant, part of aging. Some things can speed up the formation of cataracts, such as steroids, common medications to treat conditions like arthritis and lupus. Phenothiazine drugs such as chlorpromazine, thorazine, used to treat a variety of conditions such as schizophrenia and bipolar disorder. Eye surgery or eye injuries. Radiation treatment to your upper body. Spending a lot of time in the sun without eye protection, like sunglasses. Are cataracts painful? Cataracts don't usually hurt, but they can cause discomfort by making your eyes more sensitive to light. How is a cataract diagnosed? If you have cataract symptoms, see an eye doctor, ophthalmologist, for a complete exam. The doctor will need to dilate your pupil to see inside your eye. During this test, special eye drops widen your pupil, the black part of the eye. When the pupil is wide open, your doctor checks the health of your eye. Your doctor can see if you have cataracts or other problems and find out how much of your vision is blocked. How is a cataract treated? If your cataract symptoms are mild, you might just need a new prescription for glasses or contacts. Cataracts usually worsen over time, though. Eventually, your doctor will likely recommend surgery to remove the cataract. At what stage should cataracts be removed? Most people wait until a cataract causes enough vision loss to be a problem, like making it hard to read or drive. Sometimes people need cataract surgery to see and treat other eye conditions, such as age-related changes in the retina, tissue at the back of the eye, or diabetes-related retinopathy. Who removes cataracts? An ophthalmologist, doctor who specializes in eye health, performs cataract removal surgery. How are cataracts removed? During cataract surgery, the surgeon removes the clouded lens and replaces it with an artificial lens implant. The new lens is clear, shaped to fit your eye and personalized to your vision needs. Cataract removal takes about an hour. It's done with local anesthesia, medication to numb a specific area. Your doctor will use eye drops or a shot to numb your eye. You'll be awake, but you won't feel or see the procedure. What are the different types of cataract surgery? There are two types of procedures to remove cataracts. Phacoemulsification cataract surgery. Phacoemulsification is the most common procedure for cataracts. Your ophthalmologist makes a small opening in the eye to reach the clouded lens. Using high-frequency sound waves, ultrasound, or a laser, your ophthalmologist breaks the lens into pieces. Then the doctor suctions lens fragments from your eye and puts in a new plastic lens. Extracapsular cataract surgery. Your doctor might recommend this procedure if the phacoemulsification technique isn't a good option for you. For example, an advanced cataract might be too dense to break apart easily. In extracapsular cataract surgery, your ophthalmologist makes a larger opening in the eye. Instead of breaking up the lens and then removing it, your doctor removes the lens in one piece. Then the surgeon inserts the manufactured lens. No studies have proved how to prevent cataracts or slow the progression of cataracts. But doctors think several strategies may be helpful, including: have regular eye examinations. Eye examinations can help detect cataracts and other eye problems at their earliest stages. Ask your doctor how often you should have an eye examination. Quit smoking. Ask your doctor for suggestions about how to stop smoking. Medication. Medications, counseling and other strategies are available to help you manage other health problems. Follow your treatment plan if you have diabetes or other medical conditions that can increase your risk of cataracts. Choose a healthy diet that includes plenty of fruits and vegetables. Adding a variety of colorful fruits and vegetables to your diet ensures that you're getting many vitamins and nutrients. Fruits and vegetables have many antioxidants, which help maintain the health of your eyes. Studies haven't proved that antioxidants in pill form can prevent cataracts. But a large population study recently showed that a healthy diet rich in vitamins and minerals was associated with a reduced risk of developing cataracts. Fruits and vegetables have many proven health benefits and are a safe way to increase the amount of minerals and vitamins in your diet. Wear sunglasses. Ultraviolet light from the sun may contribute to the development of cataracts. Wear sunglasses that block ultraviolet B, UVB, rays when you're outdoors. Reduce alcohol use. Excessive alcohol use can increase the risk of cataracts. Diagnosis. To determine whether you have a cataract, your doctor will review your medical history and symptoms, and perform an eye examination. Your doctor may conduct several tests, including Visual acuity test. A visual acuity test uses an eye chart to measure how well you can read a series of letters. Your eyes are tested one at a time, while the other eye is covered. Using a chart or a viewing device with progressively smaller letters, your eye doctor determines if you have 20/20 vision or if your vision shows signs of impairment. Slit lamp examination. A slit lamp allows your eye doctor to see the structures at the front of your eye under magnification. The microscope is called a slit lamp because it uses an intense line of light, a slit, to illuminate your cornea, iris, lens, and the space between your iris and cornea. The slit allows your doctor to view these structures in small sections, which makes it easier to detect any tiny abnormalities. Retinal exam. To prepare for a retinal exam, your eye doctor puts drops in your eyes to open your pupils wide, dilate. This makes it easier to examine the back of your eyes, retina. Using a slit lamp or a special device called an ophthalmoscope, your eye doctor can examine your lens for signs of a cataract. Applanation tonometry. This test measures fluid pressure in your eye. There are multiple different devices available to do this. When your prescription glasses can't clear your vision, the only effective treatment for cataracts is surgery. When to consider cataract surgery? Talk with your eye doctor about whether surgery is right for you. Most eye doctors suggest considering cataract surgery when your cataracts begin to affect your quality of life or interfere with your ability to perform normal daily activities, such as reading or driving at night. It's up to you and your doctor to decide when cataract surgery is right for you. For most people, there is no rush to remove cataracts because they usually don't harm the eyes. Diabetes, blood pressure. But cataracts can worsen faster in people with certain conditions, including diabetes, high blood pressure or obesity. Delaying the procedure generally won't affect how well your vision recovers if you later decide to have cataract surgery. Take time to consider the benefits and risks of cataract surgery with your doctor. If you choose not to undergo cataract surgery now, your eye doctor may recommend periodic follow-up exams to see if your cataracts are progressing. How often you'll see your eye doctor depends on your situation. Cataract surgery involves removing the clouded lens and replacing it with a clear artificial lens. The artificial lens, called an intraocular lens, is positioned in the same place as your natural lens. It remains a permanent part of your eye. For some people, other eye problems prohibit the use of an artificial lens. In these situations, once the cataract is removed, vision may be corrected with eyeglasses or contact lenses. Cataract surgery is generally done on an outpatient basis, which means you won't need to stay in a hospital after the surgery. During cataract surgery, your eye doctor uses a local anesthetic to numb the area around your eye, but you usually stay awake during the procedure. Cataract surgery is generally safe, but it carries a risk of infection and bleeding. Cataract surgery increases the risk of retinal detachment. After the procedure, you'll have some discomfort for a few days. Healing generally occurs within a few weeks. If you need cataract surgery in both eyes, your doctor will schedule surgery to remove the cataract in the second eye after you've healed from the first surgery. How soon will my vision improve after surgery? You may have some blurriness for a few days after cataract removal. But you should notice improved vision within the first several weeks. 9 out of 10 people see better after cataract removal. You still may need to wear glasses or contacts after cataract surgery. Your prescription may change, so be prepared to buy a new pair of eyeglasses or contacts. If you've had laser vision repair, LASIK, you may need to repeat it or wear glasses or contacts after cataract removal. Will I need to have cataract surgery again in the future? If both your eyes need cataract surgery, your doctor will probably schedule your surgeries several months apart. Separating the surgery gives both eyes a chance to heal. It also minimizes the disruption on your life. The lens implants for cataracts are permanent and usually don't need to be replaced. In some rare cases, you can develop what's called a secondary cataract. Cloudiness builds up on the surface of the artificial lens weeks, months or years after surgery. It's fixed with a quick laser surgery called posterior capsulotomy. The procedure takes just 5 minutes. Your ophthalmologist uses a laser to make an opening in the lens to let light in again. Your sight should improve within 24 hours.
How can I see better without surgery?
Early on, your vision loss from cataracts may be mild. You can try managing it by using a magnifying glass for reading, wearing polarized sunglasses, which reduce glare, using brighter light bulbs, since it's easier to see with more light.